This week's edition of Professional Insights brought to you by the National Referral Network and hosted by two incredibly charismatic bald guys, both of whom are named Mike. Good morning to you, sir. I'm Mike. He's Mike. How are you?
Good morning, Mike. How are you?
I'm doing fine. Does it seem like you got a double dose of charisma? Like there's somebody out there in the world that doesn't have any at all because you got like a double dose. I just,
Well, I'll tell you what, I woke up just eyes wide open at 4:45, hit the gym, and I'm here. I'm ready to rock. Let's go.
All right. Well, I hit the gym this morning too, and I don't know if he hit the gym or not, but our guest is Corbin Ebert of Inverness Insurance, and he's involved in the field of employee benefits and is going to talk to us a little bit about that. But first, I want to just explain the purpose of this presentation is to share professional wisdom, expertise, and you guessed it, insights so that professionals of any persuasions can benefit. I hope I said that correctly. Anyway, Corbin, I got a lot of questions for you. So let's start at the beginning. What makes you and your firm unique?
Well, our firm and me as the figurehead really try to keep our fingers on the pulse of the industry. We want to make certain that we know exactly what's going on at all times. We see what direction the river is sort of flowing. And we also happen to be one of the top brokers in the state, specifically with one carrier. We're one of only 15 brokers that has a dedicated claims representative. So for example, I call up Chris, and when I get a claim or something happen, call up Chris and he adjudicates it right then and there. So very prestigious.
That's kind of a big deal because when health insurance claims come in and you get routed to this person or that person or that person, it can be kind of a rat's nest. So you're saying you've got a dedicated person. So if an employer has a health plan with you and they're having a problem, they just call you, you call Chris, and that's that, right?
Yeah, with that specific carrier, we don't have to deal with 800 numbers. We got some direct lines, especially with quite a few carriers. So, and we have, we know a lot of people within the carriers and within the industry.
Wow, that's huge.
So Corbin, there's always this conversation with monthly premiums and the difference between a price and a cost. Yeah. And you brought up a great point in terms of this is one of the value adds in terms of price and a cost, because it's not always about a cheap monthly premium. But what are some of the other top mistakes that you see when it comes to obtaining health insurance?
Yeah, you nailed one of the big things. Great question. It's people are sort of shopping for like the least expensive type of a plan. And that happens to be bronze level of benefits, something that has a fairly high deductible. And the premium happens to be less, but what I generally find is that deductible can be $6,000, $7,000, $8,000, and that's just untenable when you're actually trying to use the benefits. I've found that silver level of benefits are usually the right sweet spot. They're not that much more expensive in premium, and when you really compare and contrast the benefits, and I go through with clients, that they see the same thing that I do. I rarely try to quote bronze plans. The main reason for that is another mistake that clients make is they don't look at what the emergency room benefits are. And that's where the big zinger can be in healthcare, is that emergency room shock bill. And there's quite a few carriers out there that have a flat copayment when it comes to going to the emergency room, $250, $300, $400, $500, way better than a scenario where you're paying 20% of those emergency room bills. So those emergency room bills are enormous now. So anywhere from $5,000 to $8,000.
So you're working directly, it sounds like you're working directly with employers to help them manage not just their health insurance premium, but their overall health insurance cost. Is that right?
Yes. We're trying to make sure that we get the right level of benefits for their employees. One of the classic things that mindsets for employers right now that I think is completely off, and we try to work with them on adjusting, is one plan or does not fit all of their employees. So there's a lot of employers out there who offer one plan to their cast of employees, and all of your employees out there are not going to have the same medical needs. So what we work with them on is making certain that we offer something that fits the employees that don't need to access as much care, those that need a medium amount of care, and those that need a high level of medical coverage. And one of my classic, ways of rolling out options to keep things simple is to go with a low, medium, and high option type of plan.
And those are all built within a single plan, right? Because you have individuals that are high risk. And so how do you, what questions should somebody be asking when it comes to putting together group benefits, right? Because everybody wants to be competitive in the employment world, and there's a lot of things that differentiate different companies. What questions should they be asking someone like you to make sure that they're offering the best benefits, but also making sure that they keep the premiums low for the company?
Yeah, well, it's my job as the professional to actually turn and ask them the appointed questions to find out exactly what their industry is, what challenges they're having in retaining and bringing in employees, but also make certain that I ask them where they're at with their budget. And we generally work on terrific solutions. There isn't a client out there that we're not able to find the right equilibrium. And that's the key. You want to be able to offer employees a solid benefit level, but one of my suggestions is allow those that need some higher level of care. The employees can buy up to richer levels of benefits. And a lot of employees, as long as you're offering a good median type of a plan, feel comfortable paying a little bit more if their needs are there to get that higher level of benefit, get that bigger doctor network. And that's available. All the carriers now offer that little mix and match carte blanche thing.
Is this like that restaurant item that doesn't have a price, just says market price?
No.
You sort of pray and go, I hope I can afford this, or
not at all. I actually, in some comparisons, I liken it to a Vegas buffet. It's like, okay, you walk into the Vegas buffet, and if, you're feeling like Mexican food, there's Mexican food. If there's American hamburgers you want, you go to the hamburgers. And that's what we want to offer to the employees. But we also want a structure that isn't going to break the budget for the employer.
So you want a set of choices that is appropriate and desirable for the employee populace. But again, you're going back to managing the overall costs as effectively as possible for the employer. Because we all know that health insurance as a line item expense for business owners is the largest one, or one of the largest ones.
Exactly.
What, I think the question on a lot of people's minds might be, what changes are on the horizon? You and I discussed a couple of changes that a lot of people aren't aware of. What's out there? What should employers be aware of?
Absolutely. So one of the most interesting things, it's a brand new law. And as I mentioned earlier, try to keep my fingers on the pulse of the industry. A new law that's coming out, and it's really affecting the individual market. But as soon as we see how it does in the individual market, it's certainly going to roll over with the same rules to the employer. But it is covering your parents. So forever and a day,
wow,
adults have been able to cover their children on their health insurance. Now we're actually having a societal type of situation where the parents are either retired and might need some level of coverage. So this is an added safety net, and it's kicking off in 2023, specifically for the individual market, where adults are going to be able to cover their parents. Now, a lot of parents are going to be covered already under Medicare. Some parents, if they don't even have a stitch of clothing, are gonna, are covered under Medi-Cal. So you have some of theirs. But there's a pocket of parents, especially between 60 and 65, or those that have come in from another country or been brought in by their adult children in from another country and haven't qualified for Medicare. They have just been, lost at sea for a while. And this is meant to help them and close that type of gap. And it's going to be very interesting, and we want to see how it plays out.
So Corbin, is that just in California? Is that across the
Just in
nation?
California? Nope.
Oh,
Just
go figure. So where, like, that's a big deal, right? And
I
the California, yeah, the California retirement mandate had just finished, and a lot of people didn't know about that. Where is the best place, or who's the best person to talk to? Where does somebody find information like this to not necessarily keep the pulse on the market, but just to get information? Because a lot of people don't even know what they don't know.
Yeah, from professionals like myself. And, I currently have 29 years of experience in the industry. So I like to think I'm definitely very knowledgeable about it. But any professional broker, and one of the big things about this is, and we get asked it a lot, is like, okay, well, how much do you charge? How much is the cost? What's your fee? And we're free to all of our clients. So we get compensated, because we obviously have to earn a living, by the insurance carriers in a small level of commissions. To whichever carrier you choose, they're going to give us a small, commission for every month that you're active.
Okay.
So we're free. We don't bill you anything. B, the rates aren't any different whether you use us or if you went direct to the insurance carriers. So I strongly suggest to people, so you might as well go in and get that, added guidance, because the health insurance industry is very, Byzantine.
Corbin, I love the fact that you're helping employers manage the overall cost, because that really is the key component. But more and more, what we're seeing is employers don't just want professionals to be one thing anymore. They really would like it if they can do other things, or professionals are going to have to add additional services, because more and more clients want to consolidate more and more services with fewer and fewer advisors. How do you see your membership of the National Referral Network helping you do that? We always talk about it being that rising tide that raises all ships. How do you see it being beneficial to you in your business?
Well, it helps me reinforce my current relationships, plus also the future relationships. And what I mean by that is I am able to have more positive contacts with my clients because I have some more information to share. Now, one of the things about professionals in my industry sometimes do, and this is against my philosophy at all, they just show up once a year saying, hey, remember me? I'm here to give you a 10% increase on your premiums. Sorry to give you bad news. Please sign here and walk away. I always try to seek multiple opportunities during the year to have positive contacts with my clients, to reach out to them on things that I think are happening that are going to directly affect them, and ways that we can help them during the year. Now, the National Referral Network really lets me do that. It expands my ability to reach out and see my clients, or talk to my clients, or communicate with my clients. And I'm given positive contacts over and over and over again. So I'm not the guy who arrives on the doorstep saying, here, I'm going to cost you more money. That's not my professional mantra.
And Mike and Utah, how can people get information on this National Referral Network? This sounds like a wonderful thing, doesn't it?
Well, Mike, that's a great question.
Isn't it?
Absolutely. You can find Corbin and all of the partners on nrnamerica.com. So National Referral Network, America.com. Corbin's on there if you have any questions. I will post all the information on the various sites, YouTube, LinkedIn, and Facebook. But other than that, Corbin, thank you so much for the time. Any final thoughts, Mike, Corbin?
Well, I just want to mention one little thing. And just like Schoolhouse Rock said, 3 is the magic number. And I do think that we 3 people are involved in this. It's the client, always at the top of the pyramid, then myself as the agent, and the National Referral Network. And it's a very, triangulated type of relationship. The National Referral Network is helping me, it's helping the client helps me, I help the client. It just goes in a terrific symbiotic type of relationship. And I'm just glad to be a part of it and add that kind of dimension to it.
I
So
love it.
raise the magic number.
I think those are great comments. And if you're watching this, again, check it out at nrnamerica.com. You can get information about how the network works. You can find different professionals of different persuasions if that's what you're looking for. We're really excited to have you be a part of this, Corbin. And again, these broadcasts, which we're doing every week, we're going live at 8 a.m. every Tuesday morning, are meant to add, wisdom and insights and information that maybe you weren't aware of, so that, again, the rising tide raises all ships. So we want to thank everybody for joining us and for watching this. And again, check out the National Referral Network once again at nrnamerica.com. Thanks, everyone. We will see you next week.
Bye, guys. Thank you.